Welcome back, everyone, to another deep dive. Today, we're focusing on a medication that's pretty common in feline medicine, gabapentin. Now, it's something we often use for cats dealing with anxiety, but what if I told you it might actually be hiding some important neurological stuff during exams?
Wow, that's a thought-provoking point for sure. And there's a study from 2024 in the Journal of Veterinary Internal Medicine. It's called Evaluation of Gabapentin Administration on Neurologic Examination in 2 different age groups of healthy cats. And it really digs into that very question.
So it really looks at how gabapentin is affecting neuro exams in cats. What was different about how they did this study?
Well, they were very careful about controlling all the different things that could change the results. So they used what's called a prospective, double-blinded, crossover design, meaning basically all the cats in the study got both gabapentin and a placebo, but at different times. And no one, not the researchers and not the owners, knew what the cats were getting at any given time.
That makes sense. So that helps make sure the results are more reliable.
Exactly. And to make things even more interesting, they split the cats into 2 groups based on their age.
Right. Young and geriatric.
Exactly. So one group was healthy young cats between 1 and 6 years old. And then the other group was the older cats, 12 years or older.
Okay, so 2 very distinct groups there. And what did they find? Did giving the cats gabapentin have any effect on those neuro exams?
Here's the interesting part. A full 50% of the cats in both age groups showed either new or even worse neurological problems after they were given gabapentin.
Wow, 50%. That's a pretty big number. So what specific kinds of neurological issues are we talking about here?
Well, they looked at a whole bunch of different things when it came to neurological function. Mentation, cranial nerves, postural reactions, spinal reflexes, gait, even pain perception. But the most common new problems they saw were related to postural reactions, like how they place their paws, and also some gait abnormalities.
So things like ataxia, that unsteadiness we sometimes see, or even paresis, which is weakness. Okay, so those are pretty significant findings. And were these effects seen in both the younger and older cats?
They were, but it did seem like the older cats were a bit more affected overall.
That's a little concerning. Do we have any ideas why gabapentin might be causing these things?
Yeah.
Especially in the older cats.
Well, one idea focuses on the cerebral cortex. That's the part of the brain that's responsible for things like higher level processing and motor control. The thinking is that maybe gabapentin is somehow influencing the cortex, and that's temporarily messing with the cat's coordination and how they respond during the exam.
So it's not actually causing damage, but it's kind of like it's creating this masking effect. That could lead to a misdiagnosis.
Exactly.
Okay, so that's a pretty critical takeaway for vets, because it means we need to be extra careful, especially when we're looking at neuro exam findings in cats that have had gabapentin recently, particularly those older kitties.
Absolutely.
I'm also wondering about dosage. Did the study look at whether the amount of gabapentin given had any connection to how severe those neurological problems were?
It's interesting, they didn't actually find a direct link there.
Oh, okay.
But it does make you think about how we go about deciding on gabapentin dosages, especially for those older cats, or cats that might have kidney problems.
Because they might be even more sensitive to these effects.
That's the burning question, and it definitely needs more research.
Definitely. Lots to think about there. Now, if gabapentin could be masking these potential issues, how do we as owners or even vets know what to look for? Are there any signs that might tell us something's not quite right?
That's a really good point. Because these neurological effects can be subtle, it really highlights how important it is to observe carefully, both for owners at home and for us vets during the exam. For example, owners might notice their cat having a little trouble jumping onto furniture, or maybe navigating stairs, especially if the lighting is dim. That could be a sign of ataxia, which we talked about earlier, that unsteadiness when walking.
So even small changes in how a cat moves could be important.
Absolutely. And when we're doing the exam, we as vets need to be really paying attention to those postural reactions. Are they having trouble placing their paws correctly when you move their limbs? Are they slow to correct themselves if you gently push them off balance? These are things that could be easily missed if you aren't specifically looking for them.
And you mentioned the older cats seem to be more affected. Were there any differences in the types of problems seen between the young cats and the old cats?
You know, There was. Both groups showed those postural reaction and gait abnormalities, but the older cats tended to have more severe and widespread deficits. So for instance, all 5 of the older cats who developed problems with their postural reactions after getting gabapentin, all 4 of their limbs were affected, but in the younger group, it was more common to just see problems in 1 or 2 limbs.
Wow, that's a pretty big difference. Does that mean older cats are just more sensitive to gabapentin?
It seems that way, and it makes sense if you think about it. As cats age, their metabolism slows down, and they're more likely to have other health conditions that could make these neurological effects worse, like chronic kidney disease. It's common in older cats, and it can really change how their body processes medications.
So this is all really important information for vets who use gabapentin. How do we balance those potential benefits with these possible risks?
That's the crux of the matter. It's not about getting rid of gabapentin entirely. It can still be really helpful for managing anxiety and pain in cats. But this study is a wake-up call for all of us in veterinary medicine. We have to be more careful, more cautious in how we use it. And that starts with getting a really detailed history from the owner, including a complete list of any medications the cat is taking.
So communication with owners is key here too.
Absolutely. We need to be upfront with owners about these potential neurological effects and work together to make good decisions about using gabapentin. It's a partnership. It's about weighing the risks and benefits for each cat, considering their age, their overall health, and how bad their anxiety or pain is.
So it's not a one-size-fits-all approach.
Not at all. This study really shows how important personalized medicine is. We need to move away from the idea of a standard dose and really tailor our treatment plans to each individual cat.
It sounds like this study also raises some questions for future research. What kinds of things do you think we need to look into more?
Well, for one, we need to know more about how gabapentin is broken down in the body in different age groups, especially in those older cats. We also need to understand better how it interacts with other medications that are commonly used in older cats.
Because those interactions could be part of what's causing these neurological effects.
Exactly. And another thing to look into is dosage. This study didn't find a direct link between dosage and severity, but we need more research to figure out if using lower doses might help minimize those neurological side effects, especially for older cats or those with other health issues.
Right. And I'm also wondering about how these findings might apply to cats that already have neurological problems. Could gabapentin be making their existing problems worse?
That's a really important question, and honestly, we don't have enough research yet to know for sure.
But it's something to be concerned about.
Definitely. It's possible that in cats with existing neurological conditions, even small changes caused by gabapentin could have a bigger impact on their symptoms, maybe making their symptoms worse, or making it harder to diagnose and treat the underlying problem.
So this study really raises some important questions about using gabapentin in cats with neurological disorders.
It does, and I think it shows how much more research we need in this area. We need to understand how gabapentin interacts with different neurological conditions, how it might affect how the disease progresses, and how we can use it safely and effectively in these patients.
This has been a really insightful discussion.
It's been my pleasure, and I hope it's gotten everyone thinking and wanting to learn more about this topic.
Speaking of learning more, you mentioned earlier that the study found gabapentin did seem to reduce anxiety in the older cats, but not the younger ones. Why would that be?
You know, that's one of the most interesting findings of this whole study. And to be honest, we don't have a clear answer yet. It could be something to do with changes in brain chemistry as cats age. Or maybe there are differences in how younger and older cats break down gabapentin.
Do you think this age-related difference in how cats respond to gabapentin needs more research?
Absolutely. If we can figure out why gabapentin seems to have different effects on anxiety in different age groups, it could really change how we use this medication. It might even lead to new treatments that are designed specifically for younger or older cats.
Wow. So much more to explore.
Definitely. And it really shows how important it is to keep learning and doing research in veterinary medicine. We're always finding new information, refining our understanding, and trying to do better for our patients.
So if we want to do better, what can vets do to actually use the findings from this study in their everyday work?
Well, the most important thing is to be aware that gabapentin can mask neurological problems during exams, so we have to be extra careful, especially when we're examining older cats or cats with any history of neurological issues. It also means getting a really thorough history and carefully thinking about the potential risks and benefits of using gabapentin for each individual cat.
So being more proactive and informed in how we approach things.
Exactly. And we also have to be open and honest with pet owners. We need to make sure they understand that there's a possibility of neurological side effects, and we need to involve them in the decision-making process.
Because at the end of the day, it's a shared responsibility to make sure our feline friends are healthy and well.
Absolutely. And this study reminds us that even medications we use all the time can have unexpected effects. We need to always be learning, questioning what we think we know, and trying to improve our understanding so we can give our patients the best possible care.
This deep dive has really given us a lot to think about.
It has. It's a reminder that even in veterinary medicine, there's always more to learn and discover.
Definitely. Well, on that note, thanks for joining us for this deep dive.
It's been a pleasure.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging. It's almost like this study is a call for vets and owners to work together even more closely.
You're absolutely right. We need open and honest conversations about any medication, including gabapentin. Talking about the possible risks and benefits. It's a true partnership, sharing the responsibility for these amazing animals' well-being.
This research also really highlights the need for more research, especially when it comes to how gabapentin affects older cats and cats that already have neurological problems.
Absolutely. There are so many questions still out there. We need to understand more about how gabapentin affects those different conditions, what happens in the long term, and if adjusting the dosage could help reduce those side effects.
And maybe this research will lead to brand new treatments, ones that can help with anxiety and pain without the risk of those neurological problems.
I hope so. Science is always changing, and every new discovery opens up new possibilities.
This deep dive has been really eye-opening. It shows that even in veterinary medicine, there's always something new to learn.
I couldn't agree more. It's the constant pursuit of knowledge and the dedication to making our patients' lives better that makes vet neurology so rewarding.
It truly is. It really feels like this study is going to have a big impact on the whole field of veterinary neurology. It's making us rethink a medication we've used for so long and question some things we thought we knew.
It definitely is. You know, it's a great example of how research can really change things in veterinary medicine. We can't just assume we know everything. We have to keep asking questions, looking into things, and updating what we do based on the latest science.
This study really highlights how complicated it is, the connection between medication, age, and other health problems.
Absolutely. Every cat is different, and we need to remember that when we're taking care of them. This study really underscores how important personalized medicine is. It's not about just giving every cat the same dose. We need to tailor treatments, and even how we interpret those exam findings to each individual patient.
And it seems like all this research is also pushing for more research.
Yeah.
Especially about how gabapentin affects those older cats and the cats that already have neurological problems.
For sure. There's still so much we don't know. We need to dig deeper into how gabapentin affects different neurological conditions, what the long-term effects are, and whether adjusting the dose can help reduce those neurological side effects.
And who knows? Maybe this research will even lead to the development of new treatments, ones that can help with anxiety and pain, but without the risk of these neurological complications.
That would be amazing. Science is always moving forward, and each new discovery opens up so many new possibilities.
This deep dive has been truly fascinating. It's a good reminder that there's always more to learn in veterinary medicine.
I agree. It's that constant learning and that dedication to helping our patients. That makes veterinary neurology such a rewarding field.
Absolutely. Well, thanks for joining us on this deep dive. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.